My name is Emeka Obidebube, and I'm standing on the Kirari Hill, some meters away from the Kirari settlement, here in Goronyo Local Government area of Sokoto State, northwest Nigeria, West Africa. You're welcome to the seat of the Caliphate. I crave your indulgence to partake in this expedition we are about to embark on, whose primary objective is to consider the feasibility of the realization of the Millennium Development Goals, MDG. In other words, the MDGs addresses the problem of the people left behind. It represents a unique opportunity to forge a global partnership to address poverty in all its dimensions, not only in terms of income, but also in terms of hunger, disease, illiteracy, poor housing, discrimination, and vulnerability. Coupled with the fact that the northeastern region was recently named the poorest region in Nigeria, we shall be looking at ways of eradicating poverty and achieving other goals using Sokoto State as a case study. This program will show us how bad we need development and what governments they do to make Nigeria better. In English words, the 8 goals set by the United Nations to be achieved by 2015 are: Goal 1, to eradicate extreme poverty and hunger; Goal 2, achieve universal basic education; Goal 3, to promote gender equality; Goal 4, to reduce child mortality; Goal 5, improve maternal health; Goal 6, combat HIV/AIDS, malaria and other diseases; Goal 7, ensure environmental sustainability; and Goal 8, develop a global partnership for development. These goals can be generalized under health, education, economy, rule of law, and the environment. As we explore this rural area, it should be noted that for extreme poverty to be reduced, the transformation of lives in the rural areas must be seriously taken. As such, a strategy will have a positive impact on urban poverty, force out migration on urban areas. The 2004 Millennium Development Goals report, which was Nigeria's first report on MDG, states that based on available information, it is unlikely that the country will be able to meet the goals by 2015. However, the 2005 report was hopeful, as it concluded that there is a likelihood of attaining some of the MDG, namely achieving universal basic education, ensuring environmental sustainability, and developing a global partnership for development, that is Goal 2, 7, and 8 respectively. Furthermore, the 2007 MDG Monitor, a data bank managed by the United Nations Development Programme, the UNDP, states that good governance and strong political commitments are requisite for achieving the MDGs. So my people, if we talk of how to make Nigeria better, we go start to invest for things like rural electrification, rural telephony, better drinking water. Subsequently, we shall look at the problems being faced by the locals and provide solutions where necessary. Our belief is that with the available resources, commitment, hard work, and monitoring, 8 goals can be achieved before the deadline. If Michael Phelps of the United States can win 8 Olympic gold medals in the just concluded Beijing Olympics, that means Nigeria can also get 8 golds in all the 8 MDGs. So as we conclude on this part, I'll be seeing you down there. You're now here in Kirari village, precisely in Goronyo Local Government. We'll be coming face to face with these people and we'll be seeing the kind of life they are actually toggling out with. Definitely, Nigeria is a very rich country, but the picture we are about to view now tends to contradict that fact. Eradicating extreme poverty and hunger is the first goal of the Millennium Development Goals. An estimated 1.2 billion people live in extreme poverty in developing countries, and More than 850 million are undernourished, reports United Nations Millennium Project report. The same report also reveals that in sub-Saharan Africa, most countries are off track to achieve goal 1. Some are even regressing. Slow growth in the region has meant increase in both the percentage and number of the poor, which rose dramatically from 227 million to 314 million between 1990 and 2001. The target under Goron is to have the proportion of people living on less than $1 a day and those suffering from extreme hunger. Over 70% of Nigerians are poor and live below $1 a day. It is ironic that Nigeria, the world's 8th largest exporter of oil, will occupy such a position in the list of poor nations. Few nations have achieved healthy economic growth without agricultural and rural growth preceding or at least accompanying it. Thus, in this regard, for goal 1 to be achieved, there has to be huge investment in agriculture. The effect of agricultural growth on poverty reduction are specific to the local context and are stronger where 1. Agriculture is important to the incomes of the rural poor. Secondly, land distribution is relatively equitable. And 3, the poor consume non-tradable food staples like our local rice. Not surprisingly, it is precisely where the incidence of poverty is the highest that agricultural development has the largest effect on overall poverty reduction. However, we should be considering the challenges being faced by our rural farmers. In other words, we have to empower our rural farmers. Empowerment means providing poor rural people with the support they require in order to develop the knowledge, skill, and organizational capacity needed for accessing resources and services, negotiating with private sector market intermediaries, and influencing government policies and investments. Some 80% of the world's cultivated land is rain-fed, and it produces 60% of world food and fiber needs, reports IFAD. How can it become more productive for the poor? For the issue is not what is to be done, but how it is to be done. Among the problems being faced by the farmers and the solutions to them are: first, reversing declining soil fertility, which is perhaps the biggest challenge for the future of agriculture in many poor nations. First, there is need for the introduction of inexpensive fertilizers for use by our rural farmers. Secondly, more investment in irrigation is another way out of poverty, as it reduces climatic risk in dry regions and increases yield and cropping intensities. Thirdly, modern technology and equipment have bypassed many small farmers in marginal areas, and there has been insufficient progress in developing appropriate technologies for dry lands, uplands, and mountainous areas. There is need for provision of tractors and other modern farming mechanisms and hiring them at a subsidized rate. Fourthly, small rural producers face major challenges in selling their produce, including high transport costs, low economies of scale, lack of information, high risk, too many intermediaries, and excessive fiscal loss. Marketing costs are highest for farmers in remote or less accessible villages where buyers can exert monopoly buying power. Globalization is creating additional challenges for small rural producers, but is also offering new opportunities to access dynamic and international markets in which producers have at least potentially a comparative advantage. Thus, making markets more accessible, extending them geographically, and enhancing the terms upon which poor rural people participate in them are critical elements of any strategy to reduce rural poverty.
So we shall be talking one-on-one with these farmers, with these indigents of Kirari, to actually find out what their problem is and how we can relate this to the government to come to their aid. Standing with me here is Lawrence Israel. He'll be acting as my interpreter, and we will be talking to these indigents and finding out the problems. So my first question here is, what is your occupation?
Salamu alaikum. Wallah, wani sana'a na yake. The man right here said he's a farmer.
He's a farmer. What are your challenges as a farmer?
misali ne wace irin matsala kake fuskanta bisa ga aikin gona gaba kake? Matsaloli gaskiya ana samun su kamar wani matsaloli akwai na ƙwari masu antabbar kayan gona ko wake ko dawa. What he said was that there's a lot of problems they are facing in this area. Like there's some pests that destroys their plants wherever they planted them. So the destroys the plants, like these pests that destroys the plants.
Standing beside me here is Alhaji Magadi of Kirari Settlement here in Goronyo Local Government, and he has already shared some interesting experiences with us. The only source of drinking water in this settlement is this well that is standing right before me. It was dug about 8 years ago and is the only source of drinking water in the whole of Kirari Settlement. He claimed that several wells have been dug and they've all dried up, and this is the only source. So he's pleading and asking the government to come to their aid to provide accessible, drinkable water. It's still Emeka Obidiwe. Thank you very much. Yes. On the issues of the MDGs, I'll be talking to the local government chairman of Goronyo Local Government here in Sokoto State, northwestern Nigeria, in the person of Engineer Zubair Yari, and he will be telling us on how the government policies have been influencing the lives of the people, and how the people on the other hand have not really been helping matters to make the realization of these goals a reality. So I'll be talking to Engineer Zubair Yari, the local government chairman of Goronyo Local Government. You're welcome, sir.
Thank you.
So, sir, we'll be talking about the MDGs, and we want to know the ways how the people of Goronyo, we are using Goronyo as a case study for the whole of Nigeria, knowing the fact that over 80% of people in Nigeria live in rural areas, and the only way the MDGs can actually be actualized is by improving the lives of people in the rural areas, by thereby halving poverty come the year 2015. So we'll be hearing from you and let us know how these goals can be realized.
Thank you. Alhamdulillah, as you know, before you come in particular, I'm talking about Goronyo Local Government. Before I come in Goronyo Local Government now, we have a lot to do now in terms of education, social sectors, of health, etc. We are left behind, especially in education sector. I know. Before I came, I was a civil worker. I was a civil servant, working under local government, because I spent 29 good years in the local government. I know in and out of it. Now our people asked me to come and contest for the chairmanship, of which I done. I accepted their request. I done it. Now I'm the chairman of the local government. What am I going to do for that people now? To see that all the sectors, especially in terms of education, we are not left behind in terms of it now. Now I'm calling to our people, let's come together to join hands and help ourselves, especially in terms of health projects. So community health project, let us come and then join hands and develop our local government. We are not saying to we are not going to lay down and say everything is for government now. Let government come and do this thing for us now. We are not for that this now, because we are many. Yes. So let us come and help ourselves. Now, we used to go to the south, eastern part of Nigeria. We saw our people, those who are rich. You can see that a person now constructs a secondary school, construct 5 boreholes, extension of electricity, What about us? Are we not a human being? Are we not a Nigerian? And then we have the resources there. Just to put money inside our houses. Let us come and help our children, help our grandchildren now. Let us improve our education. Because I know, as I said, we are left behind. But now, presently, if you see our distant students in our university now, those who come from Goronyo, you see that we do better. Polytechnics, College of Education, Polytechnics. Now our people are now growing up. We are now accepting the request and the federal government. So alhamdulillah, my local government is now a peaceful local government, and then we are now united. I'm just appealing to our people that let us come and contribute. Let us come and join hands together so that we develop our.
I'm in the Sakin Gavas Palace here in Goronyo Local Government. We're here to hear his view on how the government can actually actualize the goals of the Millennium Development Goals come 2015. I'm here in this palace and you can see around me, he's having a meeting with his council of elders. So we'll just make it a little snappy and leave. So on my right is the Sakin Dallas of Goronyo. So we'd like to hear from him the ways, and if possible, can Nigeria actually meet these Millennium Development Goals before 2015, and ways of achieving these goals?
My opinion is that the goals can be achieved if only certain efforts are made. And I think the efforts are being made. For example, empowering youth, empowering women in the rural area, and also provision of some communication technology down to the local government areas. So I think this is the only area that needs to be enhanced because the technology is not yet taken to the areas, to the rural areas, and they are very, very important. So like this provision of information, internet service providers in the local government area, so that people can use internet, they can use computers for easy communication and even for easy education of their children. So I think this is very important, and but honestly I think the government is doing much by empowering youth and women in the rural areas through societies and the associations, through commerce, through agriculture, and so on and so forth. That's my own opinion.
Goals 4, 5 and 6 are all health related. Thus, we shall discuss them together under the general heading of health. First, Goal 4 seeks to reduce by 2/3 between 1990 and 2015 the under 5 mortality rate. That is, to reduce the death of small pikin who never reach 5 years. The United Nations Development Programme (UNDP) reports that reduction of child mortality remains likely a big challenge, as against the global target of 30 out of 1,000 live deaths in 2005. Nigeria had 110 out of 1,000 live deaths. Low maternal education, low coverage of immunization, weak primary health care system, high incidence of poverty and inequality and poor household practices accounted for high mortality rates. Under 5 mortality rates per 1,000 live beds improved from 210 in 2003 to 197 in 2004, as against a target of 64 in 2015. Percentage of 1-year-old fully immunized against measles rose from 3.4% in 2003 to 80.0% in 2004. Yet, wide disparities subsist between rural and urban centers among geographical zones. There is need for improved coordination among 3 tiers of government in the provision of health services, better decentralization of immunization management, strong advocacy on better household practices, access to drinking water, and adequate sanitation are needed for success. With the recent outbreak of polio in Nigeria, with 6 of the cases reported in Goronyo Local Government, there is need for government to up its game plan towards the final eradication of polio in Nigeria. China was able to eradicate polio with just 2 rounds of immunization. It requires dedication. However, all this should not be apportioned to government, because for some religious beliefs, some households, especially in the northern part, adamantly refuse to allow their children to be immunized. The issue of eradicating polio is a general one that requires the support of the masses. Goal 5 targets the reduction of maternal mortality ratio by 3/4 between 1990 and 2015. That is, to improve maternal health. Maternal mortality also remains a daunting challenge to Nigeria against a global target of less than 75 out of 100,000 live births in 2015. Nigeria had 800 out of 100,000 live births in 2004, reports the UNDP. Rural areas and the northern region are worse than the national average. About 15% and 46% of rural and urban dwellers did not go for antenatal care, while about 44% deliveries were attended to by skilled healthcare personnel. About 2 million women of reproductive age do not survive pregnancy or childbirth. High cost of treatments, some cultural and social practices, low patronage of health infrastructures, training of health workers, sealing up of investment in healthcare system, improved value for money in use of resources, and strong collaboration with stakeholders are required for successes. In preferring solutions to some of the challenges, the 2003 National Demographic and Health Survey provides data to track progress towards the country's attainment of health goals. Under child mortality, the survey provides that treatment of childhood diseases be integrated, like ORT, vitamin A, malaria, and smallpox, capacity development for health workers, and instill commitment in the trained personnel, and also motivation of staff, monitoring and evaluation of systems, and coordination of partners. Develop state plans for child health. For solutions to maternal mortality, the survey suggested free delivery in all federal government health facilities, free antenatal care in state governments and private not-for-profit health facilities, free essential obstetrics and gynecological care, and use of skilled manpower, that is compulsory NYSC doctors and midwife services, and training of community midwives. In talking to the Goal 6 have as its targets to have halted by 2015 and begin to reverse the spread of HIV and AIDS, malaria, and other diseases. The United Nations Development Programme reports that the HIV prevalence rate fell from 5.8% in 2001 to 4.4% in 2005. Prevalence across the country, however, varied significantly. Although AIDS orphans remain on the increase, the percentage of people reporting the use of condom during sexual intercourse with non-regular partners increased. Malaria and tuberculosis still remain the major public health problem. Malaria accounted for 60% of all outpatient attendance, 30% of all hospital admissions, and 300,000 deaths annually. Blood transmission, unsafe injection, and sexual practices are key drivers of HIV and AIDS, while stigmatization and discrimination against people living with HIV/AIDS still remain weak. Poor sanitation and high cost of treatment accounted for prevalence of malaria, while poor reporting network and weak public education are responsible for the spread of tuberculosis. Nigeria Demographic and Health Survey also listed, among others, the provision of free GCT services and provision of such services at both secondary and training level. Challenges. I'll be talking to Dr. Isaac, a resident doctor here in Shinaka Model Primary Health Center in Goronyo Local Government. He will be in a better position to shed more light on the challenges being faced. Dr. Derek.
Thank you very much. Thank you very much. The challenges being faced by northern healthcare providers and the northerners in general, I like to summarize under 3 major headings. One is poverty, the second is ignorance, and the third is political will or governance. I like to say that poverty still remains the biggest challenge both to the healthcare providers and the people in the community. I say poverty because many of the cases that we see are cases of malnutrition, and malnutrition is not a case, and malnutrition cases are not prevalent in the south because of better financial positions of parents and such situations. But in a community such as this that I've been working in, when the people of the community readily do not have access to, readily do not have the means to provide proteinous diets and balanced diets to their children, they often come to the hospital severely malnourished. Ignorance is also key in being a challenge, because many of the cases that we see at the hospital are cases that come to the hospital or to healthcare providers late. You will find situations where people have been having diarrheal diseases for a week or two before coming to the hospital, and at the time when we see them, they are moribund. And so ignorance also goes hand in hand with poverty and all of that. Another key factor in the challenges being faced is political will. Shinaka, for example, doesn't have good pipe-borne water, and by virtue of that, many of the indigenes in the community have to rely on the river or on dug-out water reservoirs, which are foci for infection, and so they come to the hospital with classic cases of gastroenteritis and bacillary dysentery, all because they do not have pipe-borne water, which is something good governance can take care of generally. Good governance would also be key in malaria. I used to practice in the south before coming to the north, and I know how far-reaching the objectives of malaria has attained. Provision of insecticide-treated nets, free anti-malaria drugs to those who are under 5 years of age. All of these things, even though they are being done here in the north, they have not been successfully achieved because so many people still come to the hospital with malaria and all of that, and so in summary, good governance, and better health education. Health education is something that is not only a government task but also the task of the healthcare providers, which is why those of us in the PH often go out into the community to educate them and tell them this and this and this is what you should do to prevent diseases and all. On that note, I would like to
This is Ilela Uda here in Goronyo Local Government area of Nigeria. And we are in one of the most remote parts of Nigeria. As you can see around you, the huts and the thatched buildings depict the level of poverty of this community. So we will go inside and talk face to face with the leader of the community of Ilela Uda. So you are welcome once more to Goronyo Local Government area of Nigeria.
Right. Very good. Very good. You farmer.
Yes, we're here with two indigenes of Ilela Uda here in Goronyo Local Government. We shall be discussing the problems being faced by this community. So with me here is Malam Aruna, and he will be telling us in English words the problems they are encountering. Aruna.
We have the problem of water and electricity, and we have no road, good road. That is our major problems. We have no schools. Our children will not attend school very well. That is our major problem here in Ilela Uda and some parts. That is our major problem.
So what do you want, from all what you've said now, what are the specific things you want government to do for you in order to reduce this hardship you are facing here?
The first problem is we need roads. and water, and also electricity. That is our major problems here. Hospital and also hospital. Yes.
Very much.
Okay.
You've heard it from him. Government, it's hard time to fix these people up. We already know that over 80% of Nigerians live in rural areas, and if the main goals of MDGs are to be achieved, we really have to start helping these people. And that's from Emeka Obidewe once more in Ilela Uda, Goronyo Local Government. See you when I see you.
Yes, sir.
No road. No road here. You can see it. You've heard it from them. It's not fiction. It's real. Among the targets under Goal 7 are to integrate the principle of sustainable development into country policies and programs and reverse the loss of environmental resources. 2. To have by 2015 the proportion of people without sustainable access to safe drinking water and basic sanitation. And 3. By 2010 to achieve a significant improvement in the lives of at least 100 million slum dwellers. The UNDP states that Nigeria's rich environmental resources is being undermined by deforestation, erosion, desertification, gas flaring, and oil pollution. Access square meters of productive land mass annually, with the worst affected states being Sokoto, Jigawa, Kebbi, Kano, Zamfara, Yobe, Borno, and Bauchi states. However, despite encouraging reports from the UN on access to safe drinking water, more still has to be done, especially in the northern region. More investments in water projects should be welcomed, as this will facilitate the actualization of the goal. However, in Jeku Ikeme's paper titled Assessing the Future of Nigeria's Economy, Ignore Threats from the Global Climate Change Debacle, he warned that over-reliance on oil for maintaining our economy would backfire when developed countries begin to shift from fossil fuels due to its impact on the environment, that is, global warming. We need to cater for our environment. It's all we have to give to the future generation. The gully erosion evidence in the southeastern states, especially Anambra State, will be addressed immediately, And also, government should stand firm on the proposed deadline on gas flaring, as the amount of gas flared could be channeled reasonably into the daily sectors of the economy. And with that, on Goal 7, which is to ensure environmental sustainability. Thank you. GSS. The resolve by government to provide basic quality education is evidence here. As we bet inside, you visualize the unique structure that beholds this citadel of excellence. With the state-of-the-art computer room, maths, physics, chemistry and biology lab, we begin to appreciate. The UNDP reports that performance on this goal is on course in 2005. About 84 out of 100 school children attend school, and an increasing number stayed there through to primary 6. Net enrollment ration in primary school education was 84.26% in 2005 as against 81.1% in 2004. The literacy rate among 15 to 24 years old also improved from 72.2% in 2004 to 80% in 2005. This success was bolstered by the implementation of the Universal Basic Education (UBE), improved policy environment, and better intergovernmental coordination in the sector. Concerted efforts are needed to reduce the cost of primary and junior secondary education, improve the quality of teaching and schooling, and sustain political commitment to implementation of the UBE. In the This Day newspaper of 3rd September 2008, a caption which read "UBED boss identified barriers to education for all program," identified social, cultural, religious and distance between home and school are some of the factors responsible for educational imbalance between male and female children in the country, and by extension, barrier to attaining the education for all goals in the country.
As regards to education, we will be looking at feasibility of meeting the MDG goal, that is goal 2, which is achieving universal basic education come 2015. A recent report from the Ministry of Information stated that the northeastern part of Nigeria is one of the poorest region, in Nigeria. And knowing the fact that over 80% of Nigerians live in the rural areas, one of the ways of uplifting or meeting the goals is by upgrading the lives of the people living in the rural areas. So at this moment, I'll be speaking to the principal of Ahmed Adamu Muazu Model Science Secondary School in the person of Alhaji Abdullah Marafa. He will be telling us why the reason for the low penetration of Western education in the north, and the reason and why and how we can reverse this trend.
Well, let me start with your first question. Why we have poor acceptance of Western education in northern Nigeria, and particularly in this zone, Northwest zone. You find that one of the factors is historical, the coming of education. The education, actually Western education started coming from the south, and the antecedents of coming to this part of the country, you find education came with Christianity, and that is the first scholars, Western education, when they started bringing education, comes with Christianity. And here the bulk of people are Muslims, so there is that apathy to Western education, thinking that accepting Western education, sending your child is like converting him to Christianity. But thank God, things have started changing, most especially the girl child education. You find up to now, you go to some communities, you find parents paying to get their wards registered to schools. But in this part of the country, we pay money to get our wards, most especially the girl child, removed from school to get married, the early marriage syndrome. So we have many actually factors, but this is the most important factors, that is the apathy towards Western education. Then secondly, there is the poverty. I mean, when you go around the villages here, you find that many people are living in abject poverty. They don't have many things to do. Aside, if you have 5 children in the house and you all want to send them to school, you find it's very difficult for you. So you in an attempt to satisfy the society, you can send one, and maybe the 4 will mend for the other one to be educated. So as such, you find the poverty level also is there. They totally also, and which is not helping us here now, is actually the political trend now in the country. Because when you look constitutionally, it says anybody with SSCE is entitled to go for any office in the country. That one is a very good development in some part of the country, but here actually it's discouraging our people even from going further, because you now find that because somebody finished secondary school and he's now a councillor earning about 250,000, 500,000, having cars and all this, it's encouraging to other people to go further. You find many people are now looking at the graduates, at people going to universities and polytechnics as people wasting their time. Because this is the society, this is the community. The society have changed drastically. We are more or less a capitalist society where we worship money. And if you don't have this money, you will not be valued. So now education, so now this thing is not actually helping us here. Because you find everybody is now looking a way of just finishing secondary school anyhow. Because with your F9 flat, you go for cancellation, you go for every House of Representative, House members, and you will earn a lot of money. And that is what your parents want you to do. So you find that is what the community wants. So you find many people will rather go for that than further education. Then lastly, if I will give, we don't have good role models. Because if there are good role models, that have we have many people that have attained professorship, doctorate, and that they have gone far in education. They should come back to their community and be role models. And not having them within the community actually is more or less making the other members of the community scaring to send their word to school. And most importantly, the government role itself. You find the government is saying they will do everything, and they know they cannot do everything. And as such, people have relaxed. And education everywhere in the world is a joint venture between the parents and it is the government and the community. And if it is not joint venture, you find people will not value it. You find government said they will pay teachers, they will buy infrastructure, they will give you food, they will clothe you, they will give you where to sleep, they will do everything. So you find the parents, because of their myopic thinking, they will think this thing is not valuable. They won't value it. So actually, government itself is contributing. At the end of the day, government cannot be able to satisfy all. So you find even the enrollment will have drastically have to reduce, because in some instances, if you say you are giving everything free, and at the end of the day you cannot provide it, then the quality will not be there. So at the end of the day, maybe we will be dropouts, some will finish and finish without very good result, because the parents are not ready to contribute. They don't even value it. So these are some of the factors actually responsible for all these problems. On the apathy level, the apathy towards Western education, we need sensitization, very drastic sensitization. And this sensitization, we need also advocacy. Advocacy is that we meet people at the grassroots. We use local malams, we use traditional rulers, we go for advocacy visit. Let us meet them and talk to them. Not only sensitization, we use radio, we use this thing, and we talk to people that education is good, and people should send their word to school. No, let us go for advocacy meeting. Let us use these traditional rulers. Let us meet these local malams. We know even in Islam, Prophet Muhammad said, you go for to search for knowledge, even if you take you to China, that is sin. And he didn't specify, he didn't say what Islamic education. And these are written in our books. So why don't we use these malams to educate people? Because they will accept what they are going to tell them. We use also traditional rulers. We go for advocacy visit, that is one. Besides the sensitization, we use jingles and other things on radio to educate people. Then finally, government should try as much as possible to open up. Let the parents contribute something towards educating their children. Let them know the value. Then also the educated people in the community should be role models. They should be coming to their communities. Maybe you come to your community and say, okay, how many people are ready to be educated? Because of this poverty level, somebody may be very good, very intelligent, but his parent is poor, and at the end of the day we are going to lose him. Contribute some money. Give them, pay their school fees, buy them provision when they are going to school, buy them books, give them everything they require.
Education is the bedrock of any economy or any nation. So government has to invest immensely in improvement of education in Nigeria. We cannot leave the future of this country in the hands of unqualified persons. Therefore, let's put our hands together and raise the standard of education. To achieve the goals, however, MDG goals, we will have to collaborate with agencies, both home and abroad, other countries, especially the advanced ones, to be able to achieve these goals. We will have to learn from the likes of the United States, Canada, Japan, India, and other industrialized countries, to learn from them and be able to create our own targets. However, Nigeria has come of age to develop its own strategy and find a way of eradicating poverty extremely. In a country like this, when telecommunication, which started in 2001, has risen to an admirable level, I guess a country like Nigeria is ready to face the challenges of the 21st century. You know what it is, development.
One of the targets under Goal 8 is to address the special needs of least developed countries, including tariff and quota-free access for least developed countries' exports, enhanced program of debt relief for heavily indebted core countries, and cancellation of official bilateral debt and more generous office development assistance for countries committed to poverty reduction. The UNDP reports that Nigeria has enjoyed the benefits of progressive partnership with international community as the decision to exit the Paris Club credit was finalized in 2005. Trade services as a percentage of export of goods and services improved from 7.3% in 2004 to 3.4% in 2005, while foreign private investment also improved significantly. However, access of Nigeria's agricultural and semi-processed goods to industrialized countries' markets remains weak. Improved macroeconomic management, promoting transparent and accountable governance, and substance of structural reforms are central to the trade partnership. Following the debt relief extended to Nigeria in 2005, the Visual Poverty Fund was established to ensure that monies released by the debt relief will be channeled towards poverty reduction and the other goals. The fund facilitated the monitoring of budget line items in MDG-related sectors and also provided a mechanism for tracking the performance of specific poverty-reducing expenditures in the budget. In addition, since 2006, on an annual basis, about $1 billion has been allocated to support progress in health, education, water and sanitation, environment, and for the provision of rural infrastructure. In this regard, having considered all the goals, the art of that likelihood of achieving the MDG is very much possible, only if the government can remain steadfast in improved areas and start rolling out its machineries in less achieved goals. Nigeria is rich. We have no reason being poor. Our resources is enough to make us among the top 20 economies come 2020. So let's put our hands together and take advantage of the oil boom and roll this sleeping giant into his deserved position. It shall be well.
In conclusion, I am affirmative, I am positive that the EG goals can be met come 2015. Nigeria has all the resources, both human and mineral, to achieve MDG goals come 2015. However, all hands must be put on deck to make sure that these goals are achieved within the time frame. It is Emeka Obidemude from right here in Goronyo Local Government area of Sokoto State, northwestern Nigeria, West Africa. We're going to make it. There's no doubt about it. See you soon.